Good evening, afternoon, and twilight, one and all. I originally planned for this episode to be about scam emails, but then I ended up getting busy with work, school, and life, so instead I found a post on Instagram that I believe would be helpful. This means I'll be giving the credit to account that I found the post on. So everyone, I found this post from an account at WriterFreds. Be sure to show some support to them. They post a lot of helpful and informative content. Now, variety of medical terms. Just a quick thing. Sorry if I mispronounce any of these words. Now, let's get into this week's meeting. Benign, not cancerous. Malignant, cancerous. Biopsy, a tissue sample for testing purposes. A doctor should recommend a biopsy when an initial test suggests an area of tissue that in the body isn't normal. Hypotension, low blood pressure. Hypertension, high blood pressure. Lesion, a wound, sore, or cut. Anti-inflammatory, reduces swelling, pain, and soreness, such as ibuprofen or naproxen. Drugs include non-steroidal and anti-inflammatory drugs, NSAIDs. Body mass index or BMI, body fat measured based on height and weight. It is inaccurate as it doesn't count for muscle mass and bone density, so doctors usually need to use contextual evidence to decide whether a patient is healthy or not. Example, if a bodybuilder's BMI is in the overweight category, it could be because he has very high muscle density, and muscles even is heavier than fat. Non-invasive treatment. Doesn't require entering the body of instruments, usually simple. Examples include exercise/physical therapy, behavioral techniques, massage, dietary modification, and acupuncture. Outpatient. Check in and check out the same day. Inpatient. Plan to stay overnight for one or more days. In remission. Disease is not getting worse and symptoms are getting better, not to be confused with being cured. Membrane. Thin layer of pliable tissue that serves as a covering or lining or connection between two structures. Acute. Sudden but usually short. Example, acute illness. Angina. Pain in the chest related to the heart that comes and goes, caused by reduced blood flow to the heart muscles. It is not usually life-threatening, but it's a warning sign of a risk of a heart attack or stroke. Gastroesophageal reflux disease, or GERD. Heartburn. Essentially stomach acid frequently flowing back into the tube connecting your mouth to your stomach. Cellulitis. Common bacterial skin infection that causes redness, swelling, and pain in the affected area of the skin. Epidermis. Outermost layer of skin. Neutrophils. Most common type of white blood cell that acts as your immune system's first line of defense by engulfing and destroying pathogens. That one I learned from an anime. Edema. Swelling caused by excess fluid trapped in your body tissues. Embolism. A blocked artery caused by a foreign body, such as a blood clot, fat material, or an air bubble. Sutures. Stitches. Sterile surgical threads used to repair cuts and close incisions from surgery. Some wounds may require an alternative method like metal staples instead of sutures. Polyp. Tissue growths that most often look like small, flat bumps or tiny mushroom-like stalks. Compound fracture. Broken bone that protrudes through the skin. And that's everything for this week's meeting. Next week's episode will be quite short. It'll just be me going over the changes on the podcast and rebranding. So for any of my experienced listeners with questions, you'll be able to have your questions answered next week. English. Follow at CWC Publishing on Twitter Check out my novels Death Chill, Flame Ribbon, Arctic Blaze on Amazon and Kobo, link in description. Check out the Creative Writing Club Discord server in the description. Check out the Creative Writing Club Instagram at creativewriting_club. Check out my personal Instagram at dark_night_wolves. And time to get back to writing instead of studying medicine. Phew.